Well, hormones really, we live in a society where we're bathed in these chemicals, and they affect our hormones, and our diets affect our hormones, and stress affects our hormones. If we can talk about thyroid hormone for a bit, when I went into practice, when I was trained in medical school, I should say, having a thyroid problem was so rare. It was incredible. Now, when I speak in front of audience, I kind of routinely ask how many people have a thyroid problem, and anywhere from 40 to 50% of the audience raises their hand. And I believe
Hmm.
that's mainly because of the chemicals we're bathed in. And so that's a problem that's hard to get away from. You can help with detox and diet and that kind of thing, but it's very common to need thyroid supplementation in people who have psychiatric disorders. I have one patient with ADD, and we tried all these medicines, and what ended up happening is I had to give him high doses of thyroid hormone, and his ADD went away. All the coaching and all the techniques that he knew were good, but he couldn't really implement on a consistent basis. As soon as we corrected his thyroid problem, the ADD was pretty much gone. And the problem there was uh, the receptors, most likely it was the receptors in the brain, which we can't measure, were insensitive. So we had to give him enough that the brain was taken care of, even though the blood levels were very high. But he didn't have any symptoms of having too much thyroid hormone. So the thyroid
Hmm.
plays a role in many psychiatric problems, and it's tied to the adrenal glands, which are our stress glands. And the adrenal glands, because we are often so stressed, over time they kind of take a hit and they affect our health and our mental health.